All right. Good afternoon, good morning, good evening. Depends on where you are connected from. We are so excited to be back once again on Kinaet Show. My name is Emmanuel Adegbola, and I'm so fired up and excited to be here today with my host, my co-host, and of course, we have two special guests today. So, as usual, this is not a radio communication, it's not a one-way communication. This is a two-way communication. So, please do us a favor. Make sure you are commenting. If you are watching this from Dr. Kina's YouTube channel, make sure you subscribe. If you are watching this on Facebook, make sure you like the video, share with someone, share with your friend. Make sure you share this video 10 times. Share 10 times because you don't know whom you might be helping. Okay, then let's get to the party for today. I'm going to be bringing in our guests. They will introduce themselves one after another and we will get the party started. Okay, so let me start from Dr. Law. If you could just introduce yourself to our audience.
Hello, audience and listeners. We are also back here today to give you a little bit about your health. And I am a nurse practitioner and a doctor of nursing practice based in Maryland. I have a clinic in Maryland called Korea Healthcare Clinic. I do basically primary care, but I do other things like vaccinations and COVID tests and all that. So I've been to this program severally, and we do a lot of other programs to help our people both back home in Nigeria and also from here with radio stations in Nigeria. So this is something I like to do, and I'm glad I'm here today. Thank you all.
All right. Thank you so much for that introduction. Yeah, Dr. Choma is in the house. Let the party begin. So I believe you are settled. If you don't mind, could you just introduce yourself to our audience?
Hello, my name is Dr. Chioma Ogunedo. I am a nurse practitioner by profession. I live in Boston, Massachusetts. I do house calls. I'm a family nurse practitioner. My joy in life is providing help for the underserved, especially in Africa, and I enjoy doing it. I have a privilege of meeting people, treating people, and seeing them as they are, and that's my God-given gift. And I thank you for inviting me today to be part of this.
Awesome. Thank you for accepting the invitation also and showed up. Okay, I'm going to bring in my co-host to introduce himself. Then I will come to our last guest. So, Mr. Alex, go ahead and introduce yourself.
Well, my name is Alex Swahiri. I'm a co-host of this program, and I do a number of stuff for David Domenico Foundation. Thank you.
A lot of stuff. I like that. Okay, so let's bring in one of our guests again today, Dr. Stephanie. Go ahead and introduce yourself to our viewers.
Hi, I'm Dr. Stephanie Opasanju. I am a medical doctor trained in internal medicine. And after almost a year of residency, I decided that I'd open up my own clinic. So that's what I do now, primary care, kind of a mixture of family and internal medicine. And I work in an underserved community in the Dallas-Fort Worth area. That's one of my passions. Serving the underserved and just being that beacon of light and hope and health and wellness and a model for people in those communities that lack that kind of a role model. I'm really excited to be here on the show and not to just share my own thoughts, but to also learn because we are constantly evolving and learning. And in this medical field, that's just a lifelong goal. So thank you for having me.
Awesome. And I love that. I love that mindset because it's not just to give, also to receive. And when you come with the mindset to learn, definitely that is, I'm not surprised why you start your own clinic also at the younger stage, that you are not waiting till when you retire or you are about to retire before you start your clinic. That is so awesome. Okay, without any further ado, with every standing ovation while we remain seated, Join me to welcome the host of the show, Dr. Kina Omeneko, to introduce today's topic, and I'll hand over to her and Mr. Alex while you see me in and out, just managing all the technicalities. Over to you.
Hello, everyone. Welcome all our viewers from all over the world. Welcome to our show today. Our panelists, Dr. Law and Dr. Choma, are regulars on this show, and Dr. Stephanie, welcome. I'm glad to have all of you. Today, we are going to talk a little bit about our health and how to stay healthy. This is not the first time we are treating this topic. But I recently went to Pastor Emmanuel's church and gave them a talk on preventive healthcare. And I decided that it would be a good thing to share whatever information I had for his community to the general public as well. So you all have heard about the adage, health is wealth. And many people have lost glory and benefits of good health because of ignorance or how to live and stay healthy. Once you have a serious health challenge in life, it is difficult for you to meet your dreams, and your destinies are compromised because you cannot function to meet um, those your future ambitions in life. So today's show is going to share with everyone several tips on how to live healthy and how to live a robust life while maintaining life balance. We will also bring you up-to-date information on COVID-19 vaccination schedules and the new variant of COVID-19. So stay tuned. We have a packed day today. Welcome.
Awesome. Thank you so much. What an elegant appearances for all of us. So let me hand over to Mr. Alex as he keeps smiling. Let him just take it off from me over there. Mr. Alex, over to you.
Okay, thank you very much, Dr. Emmanuel. Dr. Lawson, we need to establish and explain what we mean by good health and wellness, and we take off from there. Let's lay a theoretical framework for what good health is. Dr. Law, over to you.
Yes, the issue of what is good health has been something many people try to extrapolate on for a long time, because people have varying emotional and physical conditions, and yet they achieve what they want in life. And then the question becomes, what is actually the standard that you consider good health? So, but basically, once somebody can function and is able to do all he is required to do, is able to function in his workplace with the state of his health, with all the different things that make up good health. We say the person is in good health. There are no weakness. There's no physical pain or things that make the person uncomfortable, that makes his ability to function difficult. We might say the person is in good health. But when we go into the details of the components, the minerals, the vitamins, things that are in the body that can keep you on equilibrium and keep your homeostasis where it's supposed to be, then it becomes a question of add this and subtract this. So generally, your ability to function well keeps you in a state we can consider good health. So we can say more about the details and the different areas we need to touch on this to see the variables that can make things in a particular situation. But definitely your ability to function is your ability to be in good health. That's what I can say for now.
Okay, Dr. Stephanie, I don't know, you want to contribute?
I think
Yes, I
she's
do.
not there.
she's staying and out. Why don't you go to Dr. Choma? While we wait?
Chioma, please, can you have your inputs on this?
Thank you for the question. Good health also, when you think about
Is she okay?
as being healthy.
Okay.
So, good health means looking at the whole person and thinking about his ability to function, his ability to think right, his ability to relate to other people. Um, when you're in good health, you have to look at the general, the person has to accept that they're in good health. And people looking at them will also notice that they're in good health. So the food you eat, the way you react to situations, all that counts to your ability to function, and that makes you, have good health, so to say. Good health is a general thing, but the individual has to accept that they're in good health, and the person looking at you will also say, oh, that person is actually looking well, both physically, mentally, and internally.
Awesome. Awesome. While we're waiting for Dr. Stephanie to reconnect, does Dr. Kina has any follow-up statement or question on that?
Yes, I just wanted to add the definition by World Health Organization. According to World Health Organization, health can be described as a state of complete physical, mental, and social well-being, but not mere in the absence of disease or infirmity. So you can have certain conditions like Dr. Law and Dr. Choma tried to explain, and but you're still in good health. So that's the definition. I was wondering if Dr. Stephanie has any contribution to our trying to define what is good health.
Well, I think that first begs the question, like, what is the difference between health and wellness, And so health is kind of like the end point. It's the goal that we all aspire to, which is just a state of like, physical well-being, absence of disease and infirmities and things of that nature. And wellness are all the steps that you take to get there. So wellness is more of the journey, not the destination. And so those steps include things like, going to the doctor regularly, eating the right foods, adopting, the right diet. So I think health looks like a physical state of well-being and such, but somebody that is also well incorporates that into every domain of their life: physical, spiritual, financial, relational, and is able to just actually look like a picture of health on a day-to-day basis, if that makes any sense. So did that answer the question?
Yes,
Okay.
you're doing well.
Okay, Starlex, over to you.
Yeah, Dr. Law, I'm coming back to you again. If you will want to, what will you explain to be a holistic health approach? If you want to give, what will you describe a holistic health approach?
Yes.
I think a lot.
Yes. When you talk of health, there are so many things involved in wellness and in health. And therefore, if you choose one and leave the other, then you are not doing the total justice to the total thing, the total package of health. When we call holistic, it means we take care of everything that might impact the health of an individual. Dr. Kina has already told us about what World Health Organization has said about health. If, for instance, somebody has all the vitamins and minerals and everything, his body is functioning very well, and then in his environment, he's living in very poor condition that can cause health problems. He has very bad environment like we have in Nigeria, where people are killed every day and you have a lot of stressors. You cannot go out without fear of harm to yourself. So if you neglect those parts and talk about just the individual, you are not being holistic. Holistic means you take care of everything that can impact the health of a person. When we discharge a patient from a hospital, for instance, it follows that you go through a case manager and a social worker who also goes to the home of the person or asks questions to find out the health conditions where he's going to, because he can also come back the next day with the same condition with which you have already treated him. So holistic means you involve all the aspects, psychological, physical, environment, and other things involved. So that's in a nutshell what I think is holistic approach to healthcare. And you involve all the departments that make health possible.
Has anybody any contribution to add to what Dr. Law has said?
Yeah, I see Dr. Choma was trying to say something when he was talking.
And, actually, what happened was that I was looking at the camera and it looks like there was a disconnect. So I thought Dr. Law wasn't speaking. So I wanted to define the holistic approach to health. So, but he touched everything. In holistic medicine, you're thinking about where the person heads to toe, their environment, their religion, their relationships, everything about the person. So if I go to a doctor and I have a headache, he's not looking at only my headache. He's asking me, do you sleep well? Did you eat well? What kind of relationships do you have? Just to find out what. He's not looking at the symptoms, but he's looking at the cause, and the cause could be environmental. So in holistic medicine, you don't pick and choose. You pick the whole person and find out what the why of the disease, and you start to treat the person like that. So it's just a generalized kind of treatment, looking at the entire person.
So indirectly, we're talking about the whole of you. I mean, the whole of you, mental, psychology. I mean, no wonder, as a pastor, permit me to bring that word in also. So no wonder, we read from our Bible, the holy book, 3 John 2, that beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prosperous. So looking at the social, if you are rich, you are rich, your vital signs, everything is okay, but you might be socially sick. So that person also is still sick. And you are always there on Facebook, Twitter, Instagram, well there, but of course your blood pressure is nowhere to be found. Then you are sick. And of course you are on social media, you are rich, but then there is something going on your body that won't allow you to just sleep well. It means you are sick, and so on and so forth. And if you have all of this, but spiritually also you are not there, it means you are sick. So we're talking about holistic. Oh, wow. Okay, let me hand it over to my host once again.
Dr. Stephanie, I mentioned a little bit how I went to Pastor Emmanuel's church. Was it a couple of Sundays ago? I actually did discuss preventive care, and I touched, both children, adults, men, women. And I know we only have like half an hour and a little bit to go, but I wanted you to touch and tell people, what do they need to do in order to maintain this wellness and well-being? I know it's a broad topic, but if you could, put in a nutshell what men need to do, what women need to do, what children, adolescents need to do in order to maintain their well-being.
Yes. So thank you for that question. I just wanted to add to that previous question, just that I agree with everything everyone was saying about holistic approaches to medicine, and also that it doesn't just mean Western medicine as we know it, like allopathic medicine, going to the doctor, getting a prescription, boom, boom, boom. It also adopts like alternative medicines, if you will, or more so Eastern approaches to medicine, things like yoga, things like mindfulness, things like meditation, really incorporating spirituality, other kinds of, vitamins, supplements, things of that nature as well, to add to a more holistic approach. It's not just, I just wanted to add that, which also kind of segues into the question you just asked me, Dr. Kenya, how people can start approaching their health and wellness. So, yes, I am a primary care physician, so I do highly recommend everyone goes and gets their annual visits, starting at a young age, getting well child checks, well adult checks, and then as you go into the 65 and older population, definitely absolutely getting those yearly checks. Okay. And then that establishes a really good baseline for where you are internally, okay? And after establishing that baseline, you and your doctor or nurse practitioner, whoever, can really be in partnership and start focusing on the barriers to you getting there. So let's say you have high cholesterol or hypertension. Sure, we can throw medications at you, but what are your barriers to getting there? Can we identify, poor diets that are high in salt? What steps can you take every day to decrease your salt intake? Whether it's, getting an air fryer, if you have high cholesterol and you want to do the low fat meals, getting an air fryer. And I'm just mentioning little small steps that people can take outside of just traditional medicine and incorporate in their day-to-day life. Everyone can't adopt crazy workout regimen immediately, but can you do 10 minutes in the morning and can you do 10 minutes at night? What are some sneaky ways you can incorporate that into your work? Do you have flights of steps at work? Can you go up and down? For a lot of my older patients, how about you go up and down the driveway when you take out the trash? Just little things to contribute to that physical health portion of things. Vitamins and supplements I highly recommend for adults include things like, vitamin D, CoQ10, turmeric, some sort of vitamin C and zinc, and that's a really good baseline, and a multivitamin. So that's some. And then the other things that are so important to me, which is mental health, because that is like the groundwork for everything. Is your mental health right? Are the people and friends that you keep around, is your company okay? Is the way you think and feel about yourself okay? Emotionally, are you intact? And these are only questions you yourself can answer. And if something is amiss, if you find that you're unsettled in your spirit some way, you need to start really doing some introspection and identifying what's, wrong in your life. And if there's no shame about it, just taking steps to fixing that. Because like, I don't know who said it before me, but if the environmental and social things aren't fixed, you're not going to be well at all or healthy at all. So hopefully that answers your question. It's a really, really broad based answer, but hopefully that answers something.
Thank you for the answer. Mr. Alex.
Yeah. Dr. Stephena has done a very wonderful job, but like Kina said, it's a very vast area. And so, Dr. Chioma, could you pick up from the area she has not covered? Because this is the kernel of why we are here today. What can people do to keep themselves healthy, robust, and have a fulfilled life? She has done quite a lot, but I know there are still areas that needs to be covered.
Yeah, thanks, Mr. Alex, and thanks, Dr. Stephanie. I would like to focus my answer on 65-year-old and over, especially the ones who live here. Most of them are isolated. They stay in their homes. What I hear from them all the time is that I can't exercise, for those of us who live in the cold areas where there's snow. But going back to what she said, most of them live in apartments, whereby from apartment number 1 to 20 is like almost a quarter of a mile. So what I tell them is, in the morning when you wake up, you can do like 5 times. They're like, really? Is that exercise? Yes, it's exercise. Just doing that moves your body. Another thing we are missing, I know Pastor will agree to this, is meditation. We forget we have to set up our minds to start the day. In the morning, take 5 minutes. Start with 5. Go to 10. Go to 15, 30, depending on how much time you have, just to unwind and get yourself at a space where you can deal with the world, because there's so much chaos out there, even in your house. So when you set up by meditating, praying to God, reading your word, and then you can put in some exercise, music, and then get ready for the day. That helps you get ready. That's the way I look at it. Another thing is your food. You think about it. You have to be mindful of what you put into your body. A lot of us, we rush all the time. We don't think about foods that we are going to eat. Oh, okay. I didn't make my coffee this morning. I'll stop at this place, buy coffee, and oh, I need to eat something. I'll put donut or bagel to it. But if you plan your life, try to plan. Be mindful of what you're doing, and think about you. Sometimes I tell my kids, I say, you have to be selfish. Mommy is thinking about herself today. It's a mommy day. So don't be ashamed. Don't feel guilty when you take time for yourself. It helps you live a longer life. I don't know if Dr. Law has something to add. Thanks.
Dr. Law, over to you.
Yes. When we come out of the womb and we are lucky, we don't have any deformities or disabilities, then it is upon us to continue the trajectory of living and living well and the quality of life. Parents have a role to play at that point. And then you must make sure that the children are vaccinated because we might encounter a lot of things along the road. So vaccination is very, very important as we go, as the child grows up. But when we get to a particular age, we take responsibility for our health. And then it's at that point that we make sure we go in the line of things that will keep us and make sure that our life has good quality. There are things that the young people are easily attracted to. Some of them are drugs, smoking, drinking, and we know the epidemic that is affecting the southeast of Nigeria today, called this urumiri or methamphetamine. Those things should be avoided. It is difficult to find somebody who abuses his body, his life with drinking, smoking, and all that, who get to 70 something years of age. Most of the time, by 60 something, they have overwhelmed the body that they start having heart attacks or all forms of infirmities. They end up in nursing homes too early. So these are things we need to avoid. Good health means making the right choices, eating the right things, and avoiding things that are not going to give you those situations that will keep your body and mind together. So that's what we need to start doing. At some point, we need to start doing it. As a young person, you need to be active. Play soccer, play games, do things that you enjoy doing. As you grow older, then some of those things you have to make yourself exercise, walk around, do stuff, eat certain food substances, take your vitamins. As you grow older, then there are things you need to start doing. You need
Like
to get some help.
there are some things you need to start doing, like
You cannot be sedentary. Don't sit in one place and think you'll be healthy. It will be difficult for you to take a walk because you are weak, but still try and walk. So you can't sit in one place. Most of the people that get a lot of disability when they get to old age is people whose health condition have made them to sit in one place. So if you are able to walk around, to do things, even to start do some kind of job that makes you walk around, please do that because that will keep you ambulatory till you get to a particular age. So those are the things we need to do. Make the right choices, do the right thing, listen to your doctor, make sure you go to see your doctor annually. But if you are diabetic, if you have chronic conditions, every 3 months you must make sure you go for a review of your condition to see whether your medication needs to be changed or whether something new needs to be added. So the right choices will keep you healthy and give you a longer life. That's what I want to add to it.
awesome, awesome. Before we continue, just to kind of put it out there that you can actually download one of Dr. Kina's report. She has the Kina F Manifesto, which I believe you can download if you go directly to our website. If you visit www.drkina.com/manifesto, is a good report that, because there is limited information we can share within just 60 minutes. But if you download this, you'll be able to read and share with other people. And not just only that, when you get to that same website, you'll be able to get access to 11 commandments for Weight Watcher, which is a very, very good report also that you can download right there. And before I hand over to Mr. Alex to continue, also knows that the David Domenico Foundation, of course, is in partnership. This show, even though it's a free information, but you know that it costs time. It costs money to put resources together. Yes, we did not hire maybe like a flight or buy all our VIP partners to show up on this show, but it's because of their heart to give back. That is why they volunteer their time to show up. Now, how you can do it is to support David Domenico Foundation. Just that $100, $200, $500, $1,000, that $1 million that you keep somewhere and you don't need, you can also donate it. And it will go a long way to help people. Okay? God bless you as you do that. So I hand over to Mr. Alex as she continues.
Yeah, Dr.
Mr. Alex, before you go further, I wanted to add a few more things to what has already been said about meeting how to be healthy. There are several guidelines that in the family practice that you follow, right? Like Dr. Law mentioned, from immunization from children, even adults, there are certain immunizations for different age groups. But also, like for women, getting a yearly pap smear from age 21. There are several guidelines out there depending on the organization. And then mammogram for women from age 40. For men, prostate cancer screening from age 40, depending on which guideline you're reading, and colorectal cancer screening from age 45 for both men and women. So these are some of the screenings, but like everyone has mentioned, when you go to your doctor annually, be sure that these guidelines are followed and that you get the screenings that you need, the immunizations up to date that you need as you go to your doctor like you're supposed to go. So I just wanted to add those bits.
Okay. Yeah, Dr. Kina has added a very important point to what we've been talking about. So, Dr. Law, from what you said and from what I have also come to experience, old age, presents a lot of health challenges. And from my information, I understand that as you get older, the system begins to get weaker and weaker and weaker, and then it presents its own health challenges. So how will you address the system that is getting weak? You said if you do a work that doesn't allow you to move about, you're sedentary, it presents its own problem. But old age itself is a problem. So what information do you have? As people get older, sometimes they can't get up from bed, they can't do things they used to do. And then if they start getting weaker and older, what is the information? How do you help these people?
Well, Mr. Alex, you've added a lot of things to it already in the process of asking me the question. So you're already there. So, some fellow said at some point that you thought that old age was a time to relax. You're not going to be doing any job. Your children will come around you and assist you. So that he was looking forward to an old age where he will do no job and enjoy life. But that's not true, because old age has a lot of problems, a lot of pain. It's at that time that you have arthritis coming to cause you pain here and there. There are certain things you may want to do, but your heart even cannot even pump enough blood around your body to give you that energy. Maybe the ejection fraction of your heart has also come down, and the weakness associated with that will also cripple you. You may think you may have time to exercise, but the energy to exercise might not be there. There is what is called geriatric syndrome, whereby one thing leads to the other. Even to eat may be a problem to you because your teeth may be aching and you might not have enough muscle structure to chew the food very well and swallow. You may start pocketing some of the food in your cheek, and the weakness might not even give you the opportunity to eat what you want to eat. And you find out that most people, when they start getting to old age, they start losing weight because they're not eating well, they're not eating enough. Even if they have the food, the strength to go and get the food and eat may be a problem. So, and that's why we always like to check the albumin level of most old people because they don't get enough protein to be able to have the necessary cell division that they will keep them robust. So they also get dehydrated. They don't get enough fluid and they don't even have time. They can sleep most of the day without even eating or drinking. So we always want our geriatric population to get good hydration, good feeding, and at some point you have to physically help them to feed before they can eat. So it becomes a problem for most old people to manage their life, and therefore they need help. So old age is not easy at all. It comes with a lot of problems. I may not have exhausted it. Some other person can also talk about geriatric syndrome. Thank you.
Before someone takes over from there, I think I have a solution for that. My grandpa gave me one remote control, but it's very expensive though. So all you just have to do is you get in contact with me. You buy this remote control. Your hand will be on it. It causes your age. You won't grow older. You just remain where you are, and so with that, you don't need to worry about old age. But let me quickly ask Dr. Lord this question. I think I just feel like directing that question to you as a person. When we read the scripture, we talk about all these old people in the Bible. Before you could say somebody is old in the Bible, you'll be talking about like 600 years, 500 years old, 300 years old, 700 years old. So what happened these days that the moment someone is more or less like 60 and above, we begin to look at that person is old, and hardly do you even see people get into like 120, 150 these days. So what really happened?
Well, I don't know about the story of the Bible, whether we are using the same calibration to determine the age of people at that time and now to compare. But what I know is that in America, you're a senior when you are 55 years of age. And you are getting into old age when you are cruising from 55 to 100. Within that period, you are no longer a young person. You advanced in age. So I don't know, the feeling of aging depends on individuals. There are people who are still in their 70s and they feel and have the strength of somebody in the 50s. It depends on health conditions that have afflicted you and how you have lived your life and some of the choices you have made. Some people are very lucky and some are not. But you retire mostly. If I were in Nigeria now, I would have retired, but I'm still working here. So by 65, let us say that anybody who works to 65, officially, most countries of the world is supposed to retire. And when you retire, you are retiring because you are not able to do most of the things you would have been able to do at a younger age. Even driving, you have to take it slow. I remember some days I used to drive about 120 miles an hour when I'm going to Kansas from Dallas. But now, when I drive up to 50 miles per hour, I imagine losing control of the car sometimes. So you go slow. So the nerves and the energy, everything is slowing down. So you may not have a particular age that is called old age. It depends on the individual. But things starts to change from 30, you start going downhill. By the time you go to 55, you're almost there. But in the 60s, you are struggling. In the 70s, you need help. In the 80s, you are also managing. In the 90s, it's almost impossible to do so many things. So you know the answer to your question. Thank you.
Uh,
Okay, back to you, Mr. Alex.
Well, I don't know if anybody want to
yes,
add.
please.
Yeah.
Uh,
Okay.
I want to say so. Dr. Law, I don't quite agree with you. I think age is in the mind. Because I work with the elderly and I see some people in their 90s and they act like they're in the 60s. Yes, much as you look at them physically, they are changing a little bit. But sometimes you have to be of a strong will and good health. You know, maybe you are endowed by God with some other stuff, and you kept moving. And what most of those people tell me is that they don't sit still. They move around. They do things. They go dancing. They go to church. They meet friends. Living a sedentary life can slow you down so much. I think it's all in the mind. Don't count the numbers. Um, you can be 60 and you feel like 20. So it all depends on how you want to live your life, and if you don't have any ill health, um, slowing you down. So I would like us to put numbers, because that's not really the right thing to do right now. In those days, it used to be, but right now the number thing is not working. It's all in the mind. So
I
that's all.
agree. I
Yeah.
agree with you. I agree with you. I also mentioned that it depends on individuals.
Yeah.
Mhm.
I
So
would
go
like
ahead.
to, yeah, I would like to add a few things to what on this discussion of old age and how people actually how they are when they get to 60s, 70s, 80s. From my experience, I've worked with different age groups, and lately I've been working with a lot of older generation. And what I see and what I hear is how they live their life when they were younger is
Mhm.
what's keeping them as they get older. Many of them are like vegetarians. They never ate any red meat. You notice that a lot of them are not taking any medications in their 60s, 70s, and 80s, and try to find out what is your secret. And it's always the same answer. They're very active. They've eaten healthy, and never drank or smoked. So how you treat your body when you're younger is what's going to take you when you're older. So that's what I've found out from my little experiences in life.
Hmm. I mean, I can see that people maybe possibly above 50 or above 60 begins to think as this conversation continues like this, that okay, so just relax, just relax. Just as Dr. Choma has said, age is in the mind. So you could be a 90-year-old boy and you could be a 17-year-old man. So it depends on where you put yourself. Okay. Okay, Dr. Stephanie has been looking at, okay, what are all these people saying now? So do you have anything to say about that?
Yes, I mean, I agree with everything everyone has been saying. I do, treat a lot of the geriatric population as well. And again, the choices made in your youth, it's all preventative, so you want to prevent a problem before the problem exists. So obviously some things you can't, some things we just develop over time, some conditions we're predisposed to or whatever. But I think, like Dr. Chioma said, not placing any limitations on an individual. Society places a lot of limitations on individuals by, again, you know by I guess I guess saying essentially that after a certain age, people can't do this, or after a certain age, you shouldn't do that, or, and so that allows a lot of older patients or people in general to kind of cop out into those things and feel like they're being limited by society. But as long as their mindset is geared towards, I can do all things, I think that they can do all things, or at least they can challenge themselves to do all things. Obviously, there are some limitations, but as long as you don't buy into that belief that, that you just have incredible amounts of faith, essentially, is what I'm saying, as you get into old age.
Awesome. Just a quick commercial before we continue. There was this movie actually by Eddie Murphy that I saw a long time ago. And of course, Norbert, the guy was like a nerd when he was young and kept eating junks and hitting junks and hitting junks until he finally grow bigger than she. I mean, in that movie, he acted she until she couldn't really undo herself, and she eventually find herself, I think, in the swimming pool. I think we should just see what really happened right now.
What's that?
It's Respucia. I'm gonna show you how a bitch go down a slide. Mother of God!
Okay, so I mean, imagine she sees somebody very skinny doing, swimming. What? Anyway, I just put that one out there to kind of calm the atmosphere that we are growing old. We are still young and we are still cool, and I believe we can do what we gotta do. Okay, over to you, Mr. Alex.
Yeah, throughout last year and the greater part of this year, we've been fighting with a pandemic, and at a point in time, we said, well, we are good to go with the vaccine. But suddenly, another variant of that vaccine is now on the rampage. And so I'm asking, what do we do at this point? Where do we go from here? The old variant, Delta variant, and the COVID-19, we have not even been able to grapple with all of them. So this is another health challenge. So where do we go from here? Dr. Law, let's start with you.
Yes. When I've been giving talks about this vaccine, the COVID-19 issue, I've always said, okay, at some point, this thing will settle somewhere, and then we'll be able to analyze the problems of this vaccine, the cause of this vaccine, who even started this vaccine, where did it start, why is it so rampant now, why is so many things coming from it. But it appears to have no end now. It still continues to be a moving target. So anything we know today, tomorrow we'll have to adjust. It has become so bad that people are beginning to think that this thing is being manufactured, because we have never had it like it before. Even in 2019, when there was an epidemic, they had one or two variants, and it didn't last for this long. And this number of people did not die. But it has become a continuous process. If a new variant doesn't come from Brazil, it comes from South Africa, it comes from China, and it is on and on and on. Now we have this Omicron. We don't know the nature of this Omicron right now. Most people are still guessing. Does it affect those who have been vaccinated? All they are telling us is vaccination is the best defense for any of the variants of this COVID. So, but if it is just as the original COVID, this vaccination can protect us. Why all this hullabaloo about? flight restrictions, alarm here and there about it. If it is just the same kind of COVID that this same vaccination can protect us from, then why is the problem? So we don't know a lot about what's going on now. We don't have any evidence that people who are vaccinated are dying from it. We don't know what to believe. So I can tell you that there are so many things to be learned about this new virus. Is it real, for real? But no, to be honest to you, we are beginning to doubt it. So this is the situation we find ourselves now. I want the World Health Organization to come out clear on some of these issues that are coming out from COVID-related issues, so that we know exactly what is going on. Some people think this is an opportunity for people from a section of the world to be prevented from moving around and all that. So we are still watching. I don't know whether somebody else has something to add to this. Thank you.
Okay. Who wants to add to what Dr. Law has just said?
Okay. Well, if what I want you, I want, in the face of this uncertainty, Dr. Law has said the whole situation is fluid. There is no proper information. And from what I have seen, people have started living their lives as usual, business as usual. They are partying, they are churching, they are doing everything. People are doing as if nothing is going on. So what's the best approach? Is it to ignore it and move ahead? Or is it to follow certain protocols and take certain precautions? Where do we go from here? Because we are trying to tell our people are confused. Where do we go from? What do we do? Do we ignore it and say, well, if the vaccine is going to take care of it, or we take certain precautions? So what will you people advise as health professionals?
This is Dr. Sherman. I will actually want to say that the best thing for us all to do is not to let our guards down. You know, COVID-19 has been here since 2019, and some of us still wear masks. Some of us a lot of us got vaccinated. We still wash our hands. We still use sanitizers. I think we continue in that trend, and if possible, get the booster dose. And just be careful. Maintain social distancing, but don't isolate yourself like before. Uh, the world cannot shut down again because of this Omicron, because they actually come up with the real reason for the Omicron. I remember flying about 2 months ago to Dallas, and I'm like, how am I going to sit in the plane with the mask and all the rest of them? It's normal. I mean, we just don't be afraid. Just put in little things like wash hands, like I said before, and all that, and move on with your life. Eat healthy. And pray to God that nothing happens to you, and take the vaccine. That is my own 10 cents to all this. I'm not going to get into conspiracy theories of where it's coming from, where it's going, who is going to kill and who will not be killed, or if it's a Armageddon. It's just, we just have to be careful. Thank you.
Dr. Stephanie wants to add.
Yeah, I just wanted to add to that. Like, I agree with what has been said so far. Just a whole lot of confusion, just like at the prefaces of the initial news, and like think back to March 2020. I have my own personal opinions about it and whatever. It doesn't matter. What matters is my day-to-day, which is being a professional and being able to, I guess, synthesize information that patients aren't able to digest in their own and give it to them in a very digestible way. So that's why, it's important for us to stay abreast on like the newest guidelines, newest regulations and things like that, and deliver that to the patients. And also when you do that, because I have a whole lot of skeptics and I have a whole lot of unvaccinated patients and people that are just like, can we just go back to normal life already? Conspiracy theorists and such. Best thing I think we can do as healthcare professionals, or as people that are just setting an example in our communities, is to emphasize that, science and this whole thing is a very it's kind of unfolding before our eyes, just to kind of let them have some empathy for, you know, the professionals and the experts that are trying to get things under control, and just try to build up their faith and their confidence in the whole entire thing. Number two, emphasize to them that, hey, this is not just about you, it's also about your brother, your sister, your family members, your community. Okay, so that gets them the buy-in as far as wanting to do, you know, go through the motions of infection control, vaccination, and such, and be an example. So, you know, I wear my mask in clinic, I wash my hands, I recommend the vitamin C, the zinc, fortifying oneself on a daily basis. And then also to just depoliticize the whole thing. Don't be involved in any sort of discussions about, you know, conspiracy and this and that. I just avoid it completely and just smile and go about my business. So that's my 2 cents.
Mm. As a complete dose.
Mhm.
I would
Well,
like to,
I know our time is fast spent. We have about 5 minutes before we round off this show today. But then, just as we are talking about complete wholeness and talking about holistic health and everything, it's not what can actually complete or can be completed in just one episode. And that is why, if you are connected to this show, the best way you can help yourself, number one, follow all these our panelists, follow them on their social media handles, and they're going to be displaying it for you. Or if you have any question, you can contact them. And I believe if you just may mention that, okay, you know them or you got to know them through Kinaet Show, they will not charge you that much. They won't charge you, but they will collect honorarium. So just make sure that you know you attach yourself and they ask questions. Some of them have their possibly private blog or website. Go to their, call them, follow them, learn from them, and that is how you can actually, you know, continue from where we stopped today. So in this next 4 minutes, we normally do what we call a elevator pitch, your take home. What do you want to drop for your audience? So I guess that is where we are, and we're going to take it. Let me start from Dr. Law.
be, Pastor Manuel, before Dr. Law starts the wrap up, I would like to, a lot of people have been confused with when to get a booster dose or which one and which not to get. So I would like to just share a little bit about the booster dose guideline for individuals. If you have had Pfizer vaccine or Moderna, you can get your booster dose after 6 months from the last time you got your vaccine. If you had Johnson and Johnson, you can get your booster dose after 2 months. Now there's a vaccine for children ages 5 to 11, which is a totally different mixture and dosages for those children, not to get them confused um, with the adolescents from 12 to 18. And those that are immunocompromised can still get a booster dose after every 28 days. So we've had people who have had their booster doses and they're immunocompromised. They've had the third shot and they've already gotten the fourth shot. And so people have been very confused, but the guidelines are very clear and straightforward. If you go to your PCP, and they'll be able to guide you as to when you're due to get your booster dose. And also to mention that you can mix and match. So if you've had Pfizer vaccine and time comes for you for your booster dose and you would like to get Moderna, it is completely allowed. So if you have any questions, like Dr. Pastor Manuel said, you can reach any of us at our social media handle, um, or just leave us a message and then we will get back with you.
And just to add to what Dr. Kina said, maybe she forgot to say it. Let me remind her, she does a VIP service. So if you don't want to go out, you want a professional to come and give you your vaccine at home, even if you are the only person, as long as you are ready to pay for VIP service, or maybe in your household you are like 5, 10, or you have a group home. Well, so you want to emphasize more on that before we
Yes, yes. We do concierge services. So if you are traveling and you want your COVID-19 test done at home, or you want your vaccination, your booster doses, actually, we've been going to communities, churches. Yesterday, we were at downtown Dallas giving vaccination to the homeless, and there were several other people that organized, put together services for these homeless people. A barber was just barbing their hair. There was food truck. There was personal care, hygiene things. So it's just a great way to give back to the community and help those that really need help. But for the concierge services, for those that got the money, we are there also. So just give us a buzz and we will be there.
Awesome, awesome, awesome. So let's begin to tidy it up. And once again, I want to say a very big special thank you to all our special guest, Dr. Stephanie. I see the way you just keep smiling. I guess it's a very nice dose to make our audience to come back, because I believe they would like to see that smile once again. And Dr. Law, sometimes he will want to smile, he will control it because he wants to be political. Yeah, thank you so much also. And of course, Dr. Chioma. So just 1 minute, take home for our audience, everything we've discussed. What is it that you just want to give to them that, okay, as you go home or as you depart from this program today, this is my gift or my take home for you. Let me start from Dr. Chioma. Are you there?
I think she's frozen.
She's frozen. Okay, let's go to Dr. Stephanie. You are muted. Okay.
Sorry. I just wanted to say thank you guys again for having me. And I guess the biggest takeaway that I want you guys to go home with is that, health is wealth. All the money in the world cannot bring you back to life. Okay, so focus on your health, focus on your wellness. It's not selfish to place yourself first in all domains of life.
Please repeat that statement. Repeat that statement.
What is that?
It's not selfish to put yourself first, right?
It's not selfish to put yourself first. Not at all. Not at all.
That's my take home.
Yes. And I want everyone to remember that. And if you're in the Dallas-Fort Worth area, come see me. I have a new clinic, Elam Health and Wellness, and I'd love to see anybody and everybody. So, and even if you just want to just reach out to me on social media, I love to answer questions and just be, a wise, I guess, sage person, I guess, for my age, and offer both my personal and professional opinion at any time. And I wish everybody the best.
Awesome. Thank you so much. Dr. Chioma, are you back?
Yeah, I'm back. Yeah. My take home, and thank you again, Kina Health Show, Dr. Manuel and the panelists. It's been nice, being with you guys for the last hour. My take home is be well, be safe, live life without fears, be happy, be an encourager, meditate, and live a purposeful life. Thank you.
Wow, that is full dose. Okay, Dr. Law.
Yes, what I want to let people know is that, like Dr. Choma said, aging is in the mind. As you grow old, not everything will fall apart at the same time. Yours could be arthritis, mine could be my teeth will fall out, another person's eyes will be, somebody else will be memory, but his whole physical condition is perfect. So it's not everything for everybody. It takes everybody has his own area of weakness growing old. So take care of yourself, eat well, sleep well, rest well, don't sit in a place, move around. So that's the best thing to do for yourself. And I thank everybody for this opportunity to be in this panel. I have always enjoyed being part of this panel. Thank you so much.
Awesome. And let's have the representative for our senior citizen. I know. Mr. Alex, what is your take home from
Yeah, my
today's?
take home today is that health is wealth. If you are not healthy, then you forget it.
Awesome, awesome, awesome. And once again, special thank you. My name is Emmanuel Adigbola. It's been a privilege to co-host today's show. So over to you, Dr. Kina, as you wrap up today's show.
Wow, what another show, another episode. It was very wonderful. Our panelists did what they do best. I thank you all. I thank all our audience that are out there listening. And I'm sure everyone picks one or two things today that can help them add more miles to their age. What you do today, remember, is what's going to take you um, through your old age. And another thing I wanted to add is that there is this thing called digital well-being. Turn your phone off sometimes, and because that can run somebody crazy, you have to have a complete your mind, psychologically, spiritually, and physical well-being in order to enjoy life, in order to enjoy the things you want to do. And please visit your doctor every year. Thank you all, and we'll see you on the next show.